My name is Scott Thompson. I do work for the alumni office, but I have the pleasure of being the alumni officer for the school pharmacy. I'm not in the office, I'm working from home. And we are like that in the alumni office. Just like every place else around the world right now, we're in a new world that we're trying to get used to. And in the alumni office, we're trying to figure out how do we engage alumni, because right now we're not allowed to leave and go visit with you. So we decided that Zoom has become more and more popular, and it is very user friendly. We see such a diversity of users that it has become our tool of choice. This pharmacy school has been using it for quite some time, but we came up with this series of virtual talks so that our alumni can hear from the experts on campus about what's going on. And Dean Allen said, I'll do this. I think our alumni need to know what's going on with education and how we've been educating students in this different setting. So I'm not going to take up any more of your time, because I think it's fascinating how the school has responded to this, and I'm going to let David take it from here.
Well, thank you very much, Scott. I appreciate all you do for the school pharmacy. Well, it's a pleasure to be able to be with you all today. I want to thank you for taking a few minutes to listen to some of the updates and things I'd like to provide for you. We realize that we've had a number of opportunities for interaction with our alumni and with many other people that are our stakeholders, to not have an opportunity to engage them and to have conversations. So what I'd like to do is I'd like to step you through a number of different updates around courses, course delivery, the fall, events, safety, etc. And so if I could ask you, please, if you've got questions, please put those in the chat. And I'll ask that Sarah, when appropriate, to let me know if those are coming through, since Scott's having some technical difficulties, but I appreciate that. But please place those there. So what I'll do is I'm going to give you an overview of a number of different things, and then I want to answer your questions. A number of members of our team are here as well, so they may be better to answer your questions, but we'll do that. So I'm going to give you an overview of what's happened since we transitioned all of our mission areas. The school pharmacy missions of academic, research, and service missions that have occurred and since the COVID-19 pandemic. It's a pleasure to be able to give you an update of what's going on. As you all know, we are in turbulent times that are unprecedented. The school pharmacy has responded incredibly well. This past March, when a quick turnaround was required due to the pandemic, our faculty, our students, and our staff adapted their activities to complete the semester at a very high standard, which is the standard that the school pharmacy sets for all of our mission areas in academics, research, and service. Their efforts, quite frankly, in pivoting on a dime, were inspiring. Our first and second year students, professional students, we had a week to prepare for spring break, plus the additional week that we had after that. For our third year students, we literally had to pivot overnight. And our faculty and our staff and our students all responded, whether they're in the first or second year or the fourth year, and they did incredibly well. Scott's alluded to Zoom already. That technology was integrated in our curriculum in late 2018, so we've been using this for a while. It was not new to us. Quite honestly, that probably helped us in terms of our transition to the quote-unquote virtual environment, so we were in a really good place. We pivoted on a dime in March, and I'll tell you a little bit more about some of the things we did related to that throughout my comments. For the fall semester, we've been in full-blown planning mode. If you think about the fact that we converted to virtual overnight, and for our third-year students, and we converted virtual with a couple weeks planning, with a couple of weeks, to be able to plan for the fall semester with the entire summer was sort of a walk in the park in comparison. So we've prepared for every possible circumstance, ranging from complete shutdown to quote-unquote traditional operations. The most important thing that we're being mindful of right now, number one, is the safety, the health, and the well-being of everyone in our organization is paramount. So that's job one. Clearly 1A right behind that is the level of excellence that we have become accustomed to in the Ole Miss School of Pharmacy. That will always be extremely important to us. And I've got to tell you, our faculty did an amazing job and will continue to do an amazing job of delivering a stellar program. But the efforts I've seen so far in that transition and preparation for the fall, like I said, have been inspiring. We're going to be starting back to class later this month. Our P1 and our P3 students will begin on August the 17th. School of Pharmacy generally runs in a slightly different calendar than the university, which is not unusual. Everyone else, P2 students and everyone else at the university will be starting on August the 24th. We're watching that date very closely. Our advanced pharmacy practice experience rotations are underway for our P4 students. So we're in a good place for that. They're planned for P1 and P3 students for their introductory pharmacy practice experiences that we do for them as well. Our clinical rotations were disrupted in April and in May, and then they resumed in June. We worked with our accrediting body, the Accreditation Council for Pharmacy Education, to ensure that disruption would not have any impact on our P4 students, the class of 2020, so that they could graduate on time in May. We had a number of conversations and feedback and guidance from ACPE, and we were able to accomplish that. Our class of 2020 did indeed finish all of their requirements, and they graduated on time as well. Something else that was extremely important to us, as most, if not all of you know, our P1 class graduates with a BS in Pharmaceutical Sciences at the end of their first year. There were some things we had to do for their requirements also so that they could graduate, and we've been able to work through those things also. So very important to be able to meet those timelines. While we have only had a virtual commencement, we've not officially canceled commencement. They were able to graduate with those May deadlines as usual. Our current P4 students, the class of 2021, is on track. We have plans in place if we have further disruptions as much as possible to make sure that they will be able to graduate on time as well. As of right now, we are in almost all of our practice sites doing our experiences, our clinical experiences, and so that's all going very well. But as you all know, things change from hour to hour, day to day, week to week with regard to how we have to react to this. But as of right now, our class of 2021 for both the P4 and the P1 students looks to be on track, and we're very positive about that. Our academic affairs team has meticulously documented all the changes that we had to make during this spring semester and the changes that we've had to make for this coming fall. We're anticipating that our accrediting body, which met this past week, is going to be asking us for a detailed report about those changes. And so I'm very proud of the fact that all aspects of our organization meticulously documenting. We're pharmacists, so that's what we do anyway, as you all know. But we wanted to be sure that we had all that in place, and our folks have done a great job with regard to ACPE. We did have a site visit back in February from ACPE. The accreditation cycle is 8 years. Our 8-year accreditation cycle officially ended at the end of June. They gave a temporary extension of that. We expect to hear from ACPE within the next week to 10 days or so about our outcomes. So it went extremely well, and we're very proud of that effort. So that 8-year extension is exactly what we're expecting because we had such a positive outcome from that. Some of you are preceptors, and we want to thank you for your nimbleness in working with us for the changes and transitions and challenges that we faced, either back in the spring or going forward. And all of our preceptors have they always go above and beyond for our students, but finishing out this year and going forward for this coming year has created challenges like no other time in their practice for them individually, but also for how we deliver those experiences. And we're grateful for those contributions as well. The university as a whole will be delivering classes this coming fall in 4 different modes of teaching in the coming academic year. Those modes are traditional, which is face-to-face in the classroom. I'll tell you a little bit more about some restrictions as it relates to that. Hybrid, which is a mix of face-to-face and some online type of teaching. Remote Remote can be synchronous learning via Zoom, much like a meeting like we've got this. We did a lot of Zoom classes, and almost all of our classes were synchronous this past spring, and that went extremely well. Or strictly online, web-based courses. So those are going to be the 4 modes that we'll be in. Most of our professional courses are going to be offered synchronously in a hybrid format with the use of Zoom. So this technology is exactly how we'll be carrying forward. When we switched to Zoom in the last part of the spring semester, interestingly enough, attendance was near 100% and student performance was absolutely outstanding, as were the evaluations from the students for our faculty. Now, you might say that our students gave our faculty a little bit of a pass because of the transition and the challenges that we face, but I know that our students are very mindful of being appropriate, being objective, being fair, and being honest with their feedback. And so I think that feedback that we got from our students during that time was indeed true. Our faculty just did an amazing job. Our staff supporting them as well. But the students themselves, just being in this and being in the transition, did an amazing job also. So I'm really, really proud of the Ole Miss Pharmacy family. Face-to-face interactions in the fall semester are going to be limited for us. They'll be limited to skills activities, our skills lab, etc. The experiential activities, our clinical rotations, introductory and advanced pharmacy practice experiences. And then interprofessional activities are going to be a mix. And so it's going to depend on what the activity is and whether or not that will be face-to-face or some type of hybrid or other type of interaction. All of our face-to-face interactions, with the exception of P1 experiential courses, will stop prior to Thanksgiving. Our P1s will have some opportunities and some activities after Thanksgiving. Much of that is obviously to avoid a large group of students going home, coming back on campus, and creating transmission of COVID from individuals to individuals. So that's a big part of why we're doing that. Personal and professional development, which is one of our classes, and interprofessional education, the didactic components, as well as our professional elective courses, are going to be offered remotely. So that's how we'll be handling those types of deliveries for those courses. Most of the school's graduate courses in our master's and PhD programs are going to be offered synchronously in a hybrid format with the Zoom technology as well. When we do have in-person classes or labs or experiences for the students, they will take place on Tuesdays and Thursdays. And students will be coming in at staggered times throughout the day. We've got to manage the number of students within a space based on guidelines. We've got to manage cleaning in between groups. And so that is why that staggering will occur. We are available as always for scheduled appointments, for in-person. We will also be on campus in person on Tuesdays and Thursdays. We're going to have a staggered scheduling of many of our school pharmacy personnel to maximize social distancing throughout the week. Obviously, our research components are doing those things now. We return to campus early in July with that staggering. We still have an awful lot of people working remotely. We've managed through all that, and our folks have done an amazing job of dealing with all that and working. I can tell you that we've not missed a beat in all of our operations, whether it's HR, accounting, business, any of the academic aspects of what we do, and then the day-to-day business of all our departments and centers as well. So I'm really proud of all of the efforts of everyone in our enterprise. Campus safety is our top priority. Right behind that, again, academic excellence, but campus safety, the health and the well-being of everyone at the university is our top priority. We're following their requirements, public health guidelines, CDC, the governor's executive orders, guidelines from the Mississippi State Department of Health. Those are the things that are guiding how we're managing, how we're doing business. Everyone has got to wear a mask at all times within our buildings. Masks are being required for differing mandates from the governor's office and from the city of Oxford and the city of Jackson, but within our facilities, masks will be required at all times. 6 feet between individuals for proper social distancing. Proper and frequent hand hygiene is absolutely imperative. No student or instructor should attend an in-person class or lab or experience if they feel sick in any way. We have a symptom checker that is available online that people can use. It's a self-symptom checker to see if there's any reason that they should consider not coming in. But if they're feeling sick, they obviously should not come to that class or to come to work. Occupancy limits. This has been a very important part of how we're evaluating our classrooms and our labs, our conference rooms. We have very different capacities for those rooms based on social distancing guidelines. The university has come in with spacing in mind and has given us those guidelines as to what those maximums are in those various areas. Our student lounge on the Oxford campus is closed and will remain closed and locked for the time being. When that changes, we will let people know. Our student lounge in Jackson is a very small area outside of our main classroom, has been modified for social distance seating. We're putting up signage around our buildings to ensure that people understand the rules and guidelines and the things that we're talking about. And so that signage, if it's not up already, we've got a few areas that it's not up, it will be up in short order. Frequent cleanings of our building. We're working with facilities maintenance to make sure that those cleanings are occurring. We're putting plexiglass in certain areas where we have high public access or high interaction between individuals, so that plexiglass is up. Sanitizing stations are being installed and will be ensured to have sanitizer in them as well. Employees and students both must complete an online training module before they return to work. It's basically ensuring that they've got a sense of what's going on with COVID-19. Many of the safety things that I just talked about, all of those things are involved in how we're doing things and in the guidelines that we're putting forward. Changing gears quite a bit. I don't see any questions there, so I'll move on. With regard to our admissions process, many, if not all of you know that in our admissions process, this would be for the fall of 2021, for both our early entry and our regular entry and professional class admissions processes, we do interviews. Those interviews are going to be done virtually, so we will use Zoom technology to do that. The PCAT will not be required for admissions purposes. But it is required for scholarship consideration. That actually predated COVID, but that will continue to move forward. So students that want to be considered for scholarships will have to take the PCAT. Regular admissions, that's not required. Our admissions team is very actively recruiting. They're just not traveling. We are all under a travel freeze. To travel right now, you have to receive approval of your supervisor, the dean, the provost's office, and the chancellor. And that even includes in-state. So if I wanted to travel to Jackson for something related to that, I have to seek all those approvals, justify, ensure that we're taking the appropriate distancing and all the various guidelines into consideration. But obviously, travel is something that is being limited. There's a couple reasons for that. Number one, safety. Number two, we've had budget cuts that have been implemented. We've been able to manage those budget cuts without any furloughs, without any pay cuts, and without any cutting any salaries or anything like that. But we've also limited travel significantly because of those budget cuts as well. But I'm very pleased to tell you that we've been able to manage through those budget cuts very, very well. And I'm proud of our team, our accounting, our finance team, our business office, as well as all of our units that have contributed to those cuts to get us through there. But travel obviously is being limited for those two reasons. So our admissions team is still going to be recruiting. A lot of the students that we're going to be recruiting respond very well to Zoom technology, to other types of recruiting practices anyway. But we've been stepping this up for quite some time anyway. Our team has done a great job and will continue to do a great job. We're going to be relying on our alumni. So anything that you can do to help us in that recruiting, we would appreciate. Some of you are pharmacy champions. Pharmacy champions are individuals who we provide information to that go out and help us do recruiting. An example, an alum who lives in Ocean Springs, for example, that knows people locally would go into an elementary school, for example, and speak to an elementary science class about pharmacy and about the Ole Miss Pharmacy School. We provide them information. Sometimes we'll even join them there. But the fact that that individual is known in that community, they're likely known in that school, those are the kinds of individuals that we need helping us to recruit on the ground. So you can be an extremely important part of that recruitment process as a pharmacy champion, we call them. And we would be glad to give you more information on that if you have some interest in doing that. Face-to-face events. Many of you know that some of our events have been canceled or postponed. Some of our events that have been affected by that, our preceptor conference that we held this past spring. That literally happened from a Friday to the Wednesday the following week. We normally have 160, 170 individuals at preceptor conference. This year we exceeded 250 in our Zoom preceptor conference that was held virtually with very little notice. I've got to tell you, the feedback we received, the faculty that participated in giving that preceptor conference did an extraordinary job with short notice, and the feedback we got from the attendees was excellent as well. We're probably going to go to an alternating in-face virtual type of offering for that preceptor conference, but that's one of the conferences and one of the events that was affected. Our alumni weekend, we held out hope that we would be able to have that alumni weekend. Many of you know, if not all of you, that Larry Calvert is our 2020 Alumnus of the Year. We're very proud of Larry, and we look forward to recognizing him. Ultimately, we made a very difficult decision to cancel the 2020 Alumni Weekend and the banquet, but we will be recognizing Larry and the 2021 recipient of that award, hopefully next spring, assuming we can do that. But that planning is moving forward, and we will be doing that there. Commencement, we don't know the answer to that question. It's been indefinitely postponed. Most, if not all of you know that we did a virtual commencement that I think was very well received. Our chancellor, our provost, and many other folks participated in that. It was a great way for us to honor our graduating class, all things considered with the challenges that we face. We had a lunchtime event with our class of 2021, our P4s. We are still hoping that that's going to continue to move forward. The tablet course that we do, many of you that are involved in industry understand that we do the tableting course. That's been postponed until the spring of 2021 as well. So we'll keep you posted on what those things are. Our Board of Visitors, which is our external advisory group, I see several of you on this call. We literally are sending out, if Tricia didn't send it out already today, we're sending out an announcement soon that will be a virtual event. Actually, I think I saw that email already go out. So if you've not seen that email, I'm pretty sure that Tricia sent that out this morning. We will be doing that virtually in early October. So we look forward to that. And we think we can provide a great program for you, and we look forward to your feedback. So I want to thank you all very much for taking some time to join us today. We're glad to answer any questions that you may have. We're going to be changing how we do things, very likely. Please know that we're ready for anything and everything. Please also know how proud I am of our faculty, our staff, and our students for what they've done to date and in their preparation for the fall semester. It's an extraordinary time, but their commitment to excellence and their commitment to the Ole Miss Pharmacy family is second to none. I've said this to my leadership team, I've said it to my faculty, I've said it to my students and my staff and my research scientists. I use mine very possessively there. We're all part of the Ole Miss family. I wouldn't want to be going through this pandemic and dealing with these challenges with any other team anywhere. We have the best team in pharmacy anywhere, and I'm privileged to work with them. I'm proud of the work they've done and will continue to do as we move forward. So with that, we'll see if there are any questions that come up, and I will be glad to answer that. But I cannot thank you enough for your time today, for your interest and your support of the Ole Miss Pharmacy School. And I look forward to ways that we can stay connected during these trying times. Scott, Sarah?
Participants do have privilege to unmute if you'd like to say hello. We would love to hear from you. Certainly you can post questions in the chat. We want to know what you're thinking about. We want to know what you're curious about. We want to help you stay connected to School of Pharmacy.
Yeah, and I'll add to this. There are several members of Dean Allen's leadership team here on the call. Shows you their commitment to the school as well. And any question you have, we've got everybody from students to recruiting to even Barbara, who keeps the money in the positive, with us here today.
Well, let me take the opportunity to, I'll try and make sure I don't miss anybody, but I will introduce a few folks that are here. So if you don't mind me making those introductions, if I can ask my colleagues that are not on video to please go on video so that I may introduce you. But it is wonderful to see so many faces here. Dr. Leanne Ross is our Associate Dean for Clinical Affairs and Director of our Center for Clinical and Translational Science on our Jackson campus, is with us.
Hi, everyone.
She's waving.
Glad to see you.
Dr. Chris Harrell is our Associate Dean for Academic Affairs, and when I'm not on the Oxford campus, leads our efforts on this campus. His office has been working feverishly to make sure that all of our academics are coming forward. So Chris is with us.
Hey, everybody. Hotty toddy.
Dr. Katie McClendon is our Assistant Dean for Student Services on the Jackson campus.
Good morning. Good to see everyone. And thank you all for showing up today.
She oversees all of our student activities, organizations, and student services on that campus. She also works very closely with me in our equity and diversity and inclusion efforts. I'm really proud of the things that we're doing in that regard. Dr. Chelsea Bennett is our Assistant Dean for the Oxford campus. Her shop includes admissions, and she oversees all of our other student activities on this campus as well. Dr. Lori Fleming is on the phone with us, so she may not be able to see you. Dr. Fleming is our Director of Experiential Education and Experiential Programs. So thank you, Lori, for being with us today. Mr. Port Kegler is our Director of Development from the Foundation. So Port, thank you very much for being with us.
Thank you, and thank you everyone for attending.
I see Dr. John Bentley. Dr. Bentley is our former chair of the Department of Pharmacy Administration. He transitioned out of that role at the end of June. And he also currently serves as our Director of the Center for Pharmaceutical Marketing and Management. Ms. Barbara Nisis is our Associate Dean for Administration of Financial Operations, and she is with us. Barbara, wave. Miss Sarah Campbell, she didn't introduce herself, but she is our instructional designer, our Zoom expert, and takes care of so many things for us. Sarah, thanks for all you do, and thanks for joining us.
You're so welcome. Glad to be here.
I see Dr. Jamie Wagner, one of our faculty from the Jackson campus. Jamie, thank you for joining us. Dr. Billy Brown is one of our adjunct faculty on Jackson campus, specializes in HIV, former president of the Magnolia Group. Billy, thank you for being with us. It's great to see you here. Ms. Whitney Tarpey is our Director of Communications and Marketing. So Whitney has joined us today. Thank you very much for joining us. Mr. Don Stanford is our Assistant Director of the Research Institute of Pharmaceutical Sciences. If Don Stanford doesn't know about it, it can't be known about our operations. So appreciate all that Don does. Dr. Peter Ross, another one of our adjunct faculty, are here. Peter is also a member of the Board of Visitors, so it's good to see you, Peter. Dr. Alicia Bolden is our Associate Dean for Learning Advanced Outcomes Assessment and Learning Advancement. Did I get that right? Adewale is what I remember. Alicia's with us, so thank you very much. And have I missed any of our adjunct faculty? Board of Visitor members, Percy Malone, I see, is here. Provost Payton is here on the Board of Visitors. Have I missed anybody else on the Board of Visitors? Or, oh, I see Dr. Marie Barnard is with us, one of our faculty in pharmacy administration on the Oxford campus. Thank you, Marie. Sorry I missed you there. We have a lot of people here. Bill Calhoun is on our Board of Visitors as well. Bill, it's good to see you. Bob Booth, great to see you. Thanks for joining us. Jimmy and Carrie, I don't see Carrie in the picture, but I see Jimmy.
Yes, I'm here. Good day.
Mary Bailey, thanks for your comment. I appreciate that. It's a positive message, but it's all there. Carmen McCann is here. Thank you, Carmen, for being here. Sarah Sipes is here. Sarah, thank you for being here. I see several iPhones and other, Ashton Smith from the Mississippi Department of Health. Ashton, thank you for being here as well. Who can't I see that has an iPhone tag? If you don't mind, just unmute and tell us that you're here. Okay, maybe I got just about everybody. Emily Gravely, that's right, I see that. Thanks, Chris, for pointing that out. Emily is a recent grad, 2020 grad, right, Emily?
Yes, that's correct.
Great to see you. Thanks so much for joining us.
Thanks for having me.
Absolutely. Any other comments or questions that I can answer for anyone that's here? Scott alluded to this. We're going to be doing more of these virtual talks. They're going to be on different topics. And so Scott, is the next one scheduled? Do you have that?
Yes, the next one will be Friday, September the 4th, and it will be run by Dr. Sina Haynes, who is an expert in wellness and resiliency. And so it will be open to actually a general audience because it's a much more broad topic that is vital right now. So be on the lookout for some promotion about that, and we'd love to have you join us to hear what Sina has to say about the necessary steps to take care of ourselves.
Very good. And then through beyond that, we'll be having some more pharmacy-specific kinds of opportunities. Some of the folks around this call may be joining us as well. Other comments or questions? All right. Well, I want to thank you all very much for your time, for your support of Ole Miss, just the fact that you're here to learn about what we've been doing, where we're going on. Speaks infinitely about your support of the Ole Miss Pharmacy School. It is an honor and privilege to be your dean and to work with these extraordinary individuals during these unprecedented times. So please stay safe. If anything comes up in between these meetings, you are always welcome to reach out to me individually. We have a generic sort of central email. If you don't know where to go with a question, it's sopcentral@olemiss.edu. So please use that if you don't quite know where to send a question, or you can send it to any of us directly. But please know that I have the privilege of working with the best team anywhere. And that is a blessing, very much so. So I want to thank you all very much for your time. And I appreciate the opportunity to be able to give you an update on the best pharmacy school anywhere. Stay safe, stay well, and stay positive. Thank you.